So, hello everyone. This is the part 3 video of upper limb anatomy. So, in this video, we are going to study about the muscles of hand. So, as we all know, we are having 20 muscles in total, which is attached to the hand. So, it includes 4 thenar muscles, 4 hypothenar muscles, 4 lumbricals, 4 Palmar Interossei, and 4 Dorsal Interossei. Okay. So before going to the muscles, let us first discuss about the bones of the hand. So it includes the carpal bones, which comprises of 8 carpal bones, and we have metacarpals, 5 metacarpals, and also 14 phalanges. Okay. So 3 phalanges in each fingers except the thumb, which is having 2 phalanges. Okay, here we have this proximal phalanx, middle phalanx, and also distal phalanx. And talking about the carpals, it is an easy code to study the carpal bones. That is, she looks too pretty, try to catch her. Here S stands for scaphoid, L for lunate, here T for trachutrum, and this is pisiform, this is trapezium, trapezoid, capitate, and hamate. It comes like this, that is scaphoid, lunate, trachutrum, pisiform, trapezium, trapezoid, capitate, and hamate. So yes, we will move on to thenar muscles. So we have 4 thenar muscles, that is abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and adductor pollicis. Okay, yes. So this pollicis word, it corresponds to the thumb. Okay, the pollicis corresponds to the thumb. So the abductor pollicis brevis, please just remember these 2 figures, so it will make you easy to understand the origin and insertion. Okay, so first is abductor pollicis brevis. From the name itself, it is abduction, and pollicis, abduction of thumb. Okay, so try to remember the function of each and every muscle from its name itself. So it will be more easier for you to write in the exams. Don't try to by heart everything. Okay. So first one is abductor pollicis brevis. Okay. So the origin of abductor pollicis brevis is from scaphoid and trapezium. So in the figure, this red one is the abductor pollicis brevis. So its origin is from the scaphoid and trapezium. Okay, and where does it get inserted? So insertion. So all the origins I have written in red color, and all the insertions I have written in blue color. So where does it go and insert? So it is the lateral aspect of the base of the proximal phalanx of the thumb. Okay, this is the lateral aspect, and it is the this is the proximal phalanx. Okay, it is the lateral aspect of the proximal phalanx of base of the thumb. Okay, that is clear? Yes. Then comes the flexor pollicis brevis. What does it function? That is the flexion of the thumb. Okay, so then flexor pollicis brevis, it originates from the trapezium, trapezoid, and capitate. So this blue color muscle, that is trapezium, trapezoid, and capitate, it arises from these 3 bones, and it also has the same insertion as that of the abductor pollicis brevis. That is the lateral aspect of base of proximal phalanx of thumb. Okay guys. Yes. Next muscle is opponens pollicis. Opponens pollicis, it arises from this yellow color one. It arises from the trapezium, and it goes and attached to the metacarpal, not the phalanx. It attaches to the metacarpal, and that to the shaft of the metacarpal, and on the lateral side. Okay. Next is adductor pollicis. Adductor pollicis, it is having a speciality, that is, it originates from 2 origins. 2 heads are it is having 2 heads. That is this and this. Okay, it arises from the base of the 2nd and 3rd metacarpals, and also capitate. This is the 2nd and 3rd metacarpals, and also the capitate bone, and it gets attaches to the medial aspect of base of proximal phalanx of thumb. So I hope this much is clear. Next, we are moving on to the hypothenar muscles. So it is similar to that of the thenar muscles, that is abductor digiti minima. Here digiti minima corresponds to the little finger. Okay, little finger. So it arises from the small bone, that is pisiform bone, and it is getting attached to this medial aspect of base of proximal phalanx of 5th digit. Okay, yes. Then we are having this flexor digiti minimi. the flexor digiti minimi. So there is an important question which is often asked in every MCQs, that what are the structure arises from the hook of the hamate. So these two muscles arises from the hook of the hamate, that is flexor digiti minimi and opponens digiti minimi. Okay, these two muscles originates from the hook of the hamate. That is a very important MCQ that is often asked. So hook of the hamate. So this is the hook of the hamate. So flexor digiti minimi, it is a flexion of the little finger. The function is the flexion of the little finger. So flexor digiti minimi, it arises from the hook of the hamate and it is getting attached to the medial aspect of base of the proximal phalanx of fifth digit. Same insertion. Okay, then we have opponens digiti minimi. It also arises from the hook of the hamate and it's get attached to the that is the medial aspect of the fifth metacarpal shaft. Okay, then we have palmaris brevis muscle. It is superficial muscle. It arises from the palmar aponeurosis and it's getting attached to the dermis of the ulnar border of the hand. So I guess the hypothenar muscles are also clear for you. Next is the innervation. So all the hypothenar muscles are innervated by the ulnar nerve and all the thenar muscles except the adductor pollicis are supplied by the median nerve. Okay, so ulnar nerve supplies us or innervated by the hypothenar muscles and also the adductor pollicis in the thenar muscle, and all the median nerve is innervated to the remaining thenar muscles. Okay, I hope that is clear. Next, lumbricals. So lumbricals, we have 4 lumbricals and all the lumbricals are having a same origin, that is flexor digitorum profundus. All the lumbricals originate from flexor digitorum profundus. So the first 2 lumbricals you can see here, they are unipinnate. And the next 2 lumbricals, that is the third and fourth lumbricals, are bipinnate. Okay. The first 2 lumbricals, all the lumbricals are inserted to the dorsal digital expansion. So the first and second lumbrical is inserted to the dorsal digital expansion of second and third fingers, and the third and fourth lumbricals are attached to the dorsal digital expansion of fourth and fifth fingers. Next, the innervation. The first 2 lumbricals are innervated by the median nerve and the next 2 lumbricals are innervated by the ulnar nerve. Guys, this is the function of this lumbricals, that is flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. If this function is lost, there will be extension of the metacarpophalangeal joint and flexion at the interphalangeal joint. Okay. This is the metacarpophalangeal joint. Here extension occurs and here flexion occurs. Interossei. So anything between the bones we call them as interossei. Okay. So there are 4 palmar interossei and 4 dorsal interossei. So this palmar interossei are unipinnate and dorsal interossei are bipinnate. So there is a code that PAD and DAB. Okay. PAD and DAB, that stands for this palmar interossei, the function is adduction. Dorsal interossei, the function is abduction. Okay, and all the interossei are supplied by the ulnar nerve. Here is an important point which is often asked in MCQ, that in the middle finger there is no palmar interossei attached, and also in the middle finger there is 2 dorsal interossei attached. Okay, this is the middle finger. Here no palmar interossei attachment is there present, and but also 2 dorsal interossei are attached to this middle finger. So that's it. If you understood something, please do let me know by your subscriptions and also likes and comments.